I would like to be able to get started on time because we have a lot to talk about, a lot to think about. And so we're going to be talking now about competencies for work in communities. And Beth Velde, who's public service and community relations at East Carolina University, is going to be chairing her panel and introducing her panelists. Thank you.
Well, good afternoon. I'm Beth Velde. I'm the Director of Public Service and Community Relations at East Carolina University, a professor of occupational therapy and an assistant dean in the College of Allied Health Sciences. My current role at the university, however, is not teaching occupational therapy students, rather coordinating and directing all public service efforts of the university. ECU is a Carnegie-designated engaged university, and listening to where some of you are from, you're from one of those universities too. So my role is to help faculty and students understand how to engage with communities in doing research that helps to solve community-identified problems. It rose out of my history at ECU. 15 years ago, I went to ECU to work with a small community in Tillery, North Carolina, as an occupational therapist and as a faculty member at ECU. Tillery is one of the original 40-acre and a mule communities, and we were interested in setting up a community-built health and wellness center. And I'm going to emphasize that. I've heard a lot about community-based. I think it's a great way to go, but it's not all the way to go. So a community-built health center is truly driven by the residents and citizens of that area. So I called my community partner before I came here, and I said to him, tell me what you wanted our students to understand. What competencies did they need beyond the disciplinary skills? Nobody argues that those are important. And tell me what you think we did when we did that kind of education together in Tillery. He said, well, first of all, language conveys beliefs and actions. Your students must understand how important language is. We are predominantly descendants of sharecroppers and slaves. They need to understand names are important. They need to understand that we are not patients. I've heard that word a lot this morning. We are members of the health center. And as members, we have control and we have authority in terms of what happens here. What we do is what we do. And I emphasize that too. He taught us quickly, don't say I'm coming to do this. It's we're doing this together. We need students who have humility, who understand that differences are valued and that differences need to be learned about. We also need to define the impact. It's not just medical care. It's environmental health. It's social justice. It's also reciprocal and mutually beneficial, and we have a role in educating our students. So language was so critical in terms of the competencies that we taught, and it began with the community teaching those competencies before we taught a lot of the professional competencies. Why? Because community first in a community-built health practice. So we learned in an IPE methodology. We learned about, with, and from each other as professionals from different disciplines, as students, and as community members. And because of that about, with, and from, the IPE model that comes out of Canada, I'm a dual citizen. I spent 15 years there. I believe in that IPE model. That made a huge difference in the way we ran our health services. So disciplinary skills are critical, but keywords in the description of this session that we're going to talk about today are engage with communities and improve. And I would say improve to create positive change in health. We talk a lot about health disparities. Our focus is also health equity. The skills that we're going to talk about today have to do with doing, those behaviors and techniques that our students need to be competent, but also about attitudes, ways of thinking and believing that drive action and influences behavior. We have a motto in this community-built health clinic: to do what's right, to do it well, and to do it together to create transformational learning for all of us. And I believe that what you're going to hear today from our two panelists will emphasize very interesting ways of doing that. Juicy Ciega-Sur is an associate professor and dean of the University of the Philippines Manila School of Health Sciences. She's also a visiting professor emerita at Tokyo Medical University in Japan. Dean Ciega-Sur is an active member of training for the Health Equity Network, where she participated in developing a framework for evaluation of social accountability in medical education. She's also a member of the International Reference Group on the Global Consensus on Social Accountability in Medical Education, and a UNFPA technical consultant for the Ministry of Health in Timor-Leste, Philippines. Our second panelist is Jennifer Morton, who's an associate professor and program director of the Department of Nursing at the University of New England, as well as a core faculty for the Interprofessional Education Collaborative. Her research and scholarship interests are improving health and equity for vulnerable populations. Most recently, the University of New England's Department of Nursing received a HRSA award aimed at improving health outcomes for immigrant and refugee communities in Portland, Maine, through innovative, culturally attuned, team-based approaches with multiple community partners. Our panelists are going to present some information on their programs. We'll then turn to a discussion of some of the issues that we've discussed up through this morning, and including the topics that they're about to present.